My journey started with just a routine mammogram. Never in a million years did I ever expect my physician to say, "I'm sorry to tell you that you have breast cancer."
I was absolutely devastated. My fears were, am I going to get through this?
For me to understand what's going on with the radiation is very important. The more empowered you are, the more you can help yourself.
Radiation therapy plays a very important role in terms of cancer care overall. It's one of the three main approaches to treatment, the other two being surgery and medical oncology using different systemic drugs like chemotherapy. Radiation is a non-invasive treatment. Radiation treatments are given on a daily basis with external equipment that basically passes the radiation through you. It's like a high-energy X-ray. It's something that you don't feel. When the radiation hits the cancer cells, it causes damage that it can't repair, and then they either die or basically do not grow back, and that's essentially how the radiation works.
The vast majority of the patients we treat at this time are treated with curative intent. Early stage breast cancer has cure rates well in excess of 80 and maybe even in excess of 90%, and those success rates are maintained beyond 5 years.
Everything going as expected?
I think so.
Yeah.
When you first come to the Radiation Oncology Center, it's very helpful to bring somebody with you. Another set of ears to hear the information is always very valuable for you. So it's very important that you ask questions repeatedly throughout your entire care to make sure that you're well informed and can make the best decision for yourself.
I probably adjusted down slightly, but not a lot. Radiation is used in breast cancer in different ways depending upon the stage of the disease. In early stage breast cancer, it's used often with a smaller breast-conserving surgery as an alternative to a mastectomy. In more advanced cases where a mastectomy has to be done, radiation can still be helpful to lower the chance of the tumor returning and to improve cure rates.
All right, Kelly, here we go. Everything looks real good.
We hope that everything's been removed with surgery, but there is a chance that there could be microscopic cells left in the breast that the surgeon couldn't see and remove at the time of surgery, and radiation's like an insurance policy to get rid of any cells that could be left in the body.
Okay, so you're going to be on your back, laying down. Your arms are going to be...
There's recent data in breast cancer that suggests that we can skip the radiation in patients who are over 70 with a small tumor with clean margins. Their risk for recurrence in the breast is very low, and that if that recurrence is detected early, they can have their management done then.
For some women with early stage breast cancer, if a lumpectomy is done, instead of doing whole breast radiation, which is the most common approach to treatment, partial breast irradiation may be an option.
Partial breast radiation is usually delivered using what we call brachytherapy, where there's a radioactive source that's put into the lumpectomy cavity itself.
So what we're doing today is the simulation. It's getting ready for your treatments.
When we decide to go ahead with treatment, we go ahead to what is called a simulation, which is the planning process for radiation treatment.
Patients that are undergoing simulation for breast cancer can expect to be lying on their back on some type of an angled board with most likely both of their arms up by their head, and also having a immobilization device that keeps them in the same spot.
Okay, how's that feel, okay?
Yep.
All right.
We always ask the patient to make sure they're comfortable. It is really important that they're comfortable because it helps them relax and it helps reproducibility on their daily treatments. The physician may come in and put some stickers or wires on the patient's skin to help outline or guide the radiation in conjunction with the images that we take. Patients will receive tattoos. It helps them align for their treatment. These tiny markings will be on either side of their chest area, also in the center. It helps to outline and guide the radiation fields. Once the patient is in position, we will do a CT scan. The CT scan takes images of the treatment area So the physicians and the dosimetrists can use those images to make the treatment plan.
I think probably a little more this way to make it a little more midline. Dosimetrists are part of the radiation team. They work with the radiation oncologist to calculate the radiation dose meticulously and to design specialized radiation fields for each patient.
We can really shape the radiation beams to right where the cancer is and protect a lot more normal tissue than we used to. And that's really allowed us to lessen the side effects for many patients.
When a patient comes in for their daily radiation treatment for breast cancer, their radiation therapy team will greet them, bring them back to a dressing area that's private, make sure that they are gowned appropriately. And then when they walk into the treatment room, the team should do a double check, make sure that it's the right patient, the right treatment.
So can we have your name and date of birth?
And then they're going to be put into the same position as their simulation, which is a reproducible, comfortable position that was established on their first day.
After that, the therapist will set them up on the machine with their custom immobilization device, which was made for them during simulation. Their breast will be exposed during treatment.
We're always mindful of the patient's modesty and keeping them covered up to the best of our ability.
The patient can expect the machine to rotate around them. They'll hear some buzzing and clicking noise. Nothing will ever touch them, and they won't feel a thing. The actual treatment time is brief.
When I would come for my radiation on a daily basis, you're in the room all by yourself. You're lost in your own thoughts, and as the machine is going around you, you know that it's killing those cancer cells.
I was told that one of the side effects would be tiredness. I've been a little more tired than I probably should be, so I hope that each and every day that will improve.
The side effects of radiation therapy for breast cancer treatment include fatigue, and it's usually in the 3rd week of treatment, and it can go on for about a month after treatment is completed. The other common side effect for breast radiation includes skin erythema, redness of the skin like a sunburn, and we recommend lotions for that.
Once breast radiation is complete, there may be some changes that develop over time. Most commonly, that may be some firmness that develops within the breast or chest area, which you should discuss with your doctor.
Anything I can answer for you?
Not really.
Once treatment is over, you'll follow up with your radiation oncologist, usually about 1 month after the end of treatment, to be evaluated for any skin reaction or any side effects from treatment. After that, you'll begin a cancer surveillance program with both your medical oncologist, your radiation oncologist, and your surgeon.
See you tomorrow. Have a good one.
We recognize that nobody wants to be here, but we want the patients to know that we are here for you to fight this battle with you.
People with cancer can be cured. That is, their cancer goes away, never comes back.
I don't think anybody should be afraid. To come for the radiation was the last of it, and believe it or not, in my opinion, it was the easier part of it.
I think what I want other women to know that are going through breast cancer treatment is that it's not a death sentence. I completed my treatment a few months ago. I am back to work on my regular full-time schedule. I'm living a normal life, and I am a survivor to be. You're looking at a survivor to be.